Good afternoon. Thanks for having me and giving me the opportunity to talk about supply chain innovation at Johnson & Johnson. Johnson & Johnson is a very broad-based healthcare company, as most of you know, I guess. So we are broadly based in consumer products and OTC, pharmaceuticals, and medical devices. And across that broad portfolio of products, with that broad portfolio of products, we serve over a billion uh, consumers and patients every day. Johnson & Johnson is a $83 billion business, and we have 130,000 employees, and we're 150 years old. Um, Now, a very diverse, decentralized organization, but our credo is really our North Star and defines the principles and the responsibilities that all of the employees at Johnson & Johnson have towards our patients and doctors and nurses we serve, our employees, the communities we live in, and the stockholders. And the purpose of Johnson & Johnson is really to help people live longer, healthier, happier lives, so really help to change the trajectory of health for humanity. You can imagine that our supply chain is very complex in support of that product base and all of these operating companies. Hundreds of thousands SKUs, over 100 internal manufacturing sites, over 500 external manufacturing partners, a lot of distribution centers. As you see, we have 300,000 direct customers, a lot of suppliers, and half of Johnson & Johnson's employee base is in supply chain. When we talk about supply chain innovation, we need to go back to the broader healthcare world, right? And we all know that healthcare is changing faster than ever. And in this word clouds, you see a number of these trends and disruptions articulated. And let me pick a couple of them, which are important for the rest of the conversation. I'll start with access, right? So people demand broad, unparalleled access, and from a global perspective, there is on the kind of two extremes, right? On the one hand, in emerging markets, is the growing population, young population, middle class. On the other hand, in developed countries, there is the aging population that has to be served. Another major trend is around personalization, customization on demand. So consumers, patients want really on demand offerings, products made for them. They want to receive it or get it when they want it, where they want it, and by the way, in a touchless, instantaneous way. So it's really the Amazon experience in healthcare. The third one I want to focus you on is the pay for value, right? And the outcomes, the experience. So there's really a pivot happening in the broader healthcare ecosystem from paying for products, paying for usage to pay for value. So much more focus on differentiating outcomes and enhancing the experiences for the consumers, the patients. So, and that is really the context and the purpose for supply chain innovation. So we position supply chain innovation very strategically in service of the business and the consumers and the customers. So supply chain innovation is there to really help respond to those changes and trends in healthcare and is there to help address the emerging needs and expectations of our consumers and customers. So that's summarized on the left-hand side on the slide, right? The why of supply chain innovation, the strategic positioning. If you go to the middle on the slide, that's the what. So yeah, we build and deploy innovation solutions, but stitch them together ultimately to build differentiating supply chain capabilities. Supply chain as a service, agile, flexible supply chain, and responsiveness and resiliency. And I'll double click and talk a bit about that in more detail on the next page. If we go to the right-hand side, which is the how, you see that there are three components spelled out. One, and I'll start on the bottom, is really our innovation process, our execution engine. We start from defining the business and the customer needs. And that really helps and directs our innovation experts to explore and discover, right, potential solutions, screen them, narrow them down into proof of concepts, developing minimum viable products, and then test those solutions in the real world. And when that is successful, deploy and scale broader based on the business case and the value propositions. Around that execution process, we have two enabling elements. The first one is the governance and decision making. So along that process, we involve the right stakeholders at the right time, and they really own the decision making, the prioritization, the investments, the resource allocation. And secondly, we have a very broad partner ecosystem in support of this, right? So we really want to tap into the best of the best across the globe, academia, tech providers, suppliers, within industry and other industry partners to really help accelerate our innovation journey and accelerate the value creation and the impact we make through supply chain innovation. So that is really high level of summary of the why, the what, and the how of supply chain innovation. If I now double click on the what, if you could move to the next slide, please. So as said, we develop and deploy supply chain solutions to build those differentiating supply chain capabilities. Supply chain as a service, this is about personalization, digital enablement, digital services complementing our physical offerings. Agile and flexible supply chain, the ability to swiftly adjust and adapt to changes in demand and needs. And a responsive, resilient supply chain is that ability to react to disruptive events, challenges, but in a way that it is really with a minimal impact on supply. So it's all about that quick recovery and rebound from those situations. We focus on those three because we believe these are the three capabilities that will help us to address the changes and expectations I've been talking about in the beginning. We build solutions, individual solutions, but we integrate them in those five innovation capability platforms that is shown in the middle on the slide. And we are really organizing and structuring our innovation work around those five. Let me quickly walk through those. The first one is curated healthcare. So this is that super personalization where you have your integrated healthcare offering, not only an individual personalized product, but an offering, all your needs are delivered on your terms and routines, right? The next one is around end-to-end integrated healthcare and hospital solutions that are digitally enabled. So we're really talking about the smart hospital, the OR room of the future. So things like hospital robotics, integrated closed loop inventory and order management, and that integration between our supply chains and the hospital supply chain and operation. And I'll give an example of that later. That's the example one referred to here. The next one is around autonomous order fulfillment and multimodal delivery logistics, right? So enablement of last mile solutions, drone delivery, these type of things. The next two, which are more directly in the manufacturing space, flexible modular reconfigurable systems. I'll talk more about that on the next page also as example two, and then the whole cyber physical connectivity between humans, machines, and materials. So these are the five innovation platforms we organize ourselves around. And of course, we ultimately do all of that on the right-hand side to deliver the outcomes and the expectations. So this ties it back right to the why of innovation I've talked about on the previous pages. The reason why we're very focused on that approach, on that platform approach, is three things, right? First, as I indicated, it enables you to integrate solutions into capabilities. But second, it also really helps you to drive consistent, standardized solutions and really rapidly scale in a sustainable way. And third, from an evolution and improvement perspective, since as we know, technology evolves so fast, this platform approach also facilitates and enables future augmentations, updates, inclusions of new solutions, and also the interoperability from a system perspective between the different individualized solutions. So let's now go to the next page, and I will show you two examples of those platform approaches. The first one in the hospital ecosystem is a COVID example, basically, right, where we used our 3D printing capability and quickly repurposed those resources and approaches and capabilities to really help address for our hospital key accounts the PPE challenges, right, during COVID. And in this case, in less than 10 days between design and launch, we launched a 3D printed ventilator expansion splitter. This was a collaboration with Prisma Help in North America and US, where also with FDA we got an emergency use approval authorization that during the shortage of ventilators, that splitter could be used by hospitals to eventually use one ventilator by by basically two patients that have a very similar profile, right? So this is an example how you pivot an innovation capability to help the hospitals in those during the pandemic with the PPE shortage. If you go to the next page, I like to elaborate a bit more on those flexible modular mobile manufacturing systems. So here we're talking basically about a complete change, a next generation of organizational, operational management. So we really have a vision to pivot from the current way of working of fixed, dedicated, bespoke, capital-intensive assets into very flexible, modular, agile manufacturing and supply systems. So the core of this concept are basically what we call mobots, so mobile robotics, so unit of one operations that are AI enabled. They can be configured and reconfigured into systems, into processes, into manufacturing systems, into supply systems. And of course, that approach significantly improves and step changes our supply chain agility, the flexibility, the resiliency, obviously, because it's not only configurable but reconfigurable like Lego bricks, drives a lot of cost and cash improvements, and is really the next generation of a factory on wheels, right? Factory in a box to really localized and customized supply on wheels. And we will also leverage equipment as a service concept to make it asset light, less capital intensive. If you move to the next slide and could play the video, because the video will bring this concept and our vision to life.
Flexible manufacturing is powered by a toolkit of cyber-physical modules, with both hardware and software working together as one intelligent system. Each module can change and adapt depending on the process required. Digital intelligence enables remote management, allowing for rapid changes in production output, responding to dynamic demand. The same module can work individually or as part of a group, arranging into unlimited configurations to meet complex demands seamlessly. Each additional process adds new capability to the platform, allowing it to continuously learn and adapt over time.
Thank you. So I hope that this video brought a bit to life what we're talking about, and I can share that we're well on the way on implementing these capabilities in our operations. Building on that, and another example I want to share with regard to that digital connectivity and between humans, machines, and equipment and materials is closed-loop adaptive process control. So it's kind of a combination of two concepts, is that real-time process monitoring with solutions like PAT and others. But then you augment it with digital, so you have that closed loop improvement aspect, adaptivity and adjustments, where you leverage machine learning algorithms to learn and continuously improve your operations. The combination of the two really, of course, step changes product quality, drives a lot of cost savings, but the big game changer for us, and particularly in the pharmaceutical business, is that this capability allows you to reduce over time the offline quality testing in labs and get ultimately achieve real-time release. So you can release a product once the production is finished. And of course, this has a huge impact on supply chain agility, right? So cycle time reduction and agility of the operation. So let's go to the next slide, please. I'd like to come back on the how, right? And I talked about leveraging a really the global innovation ecosystem between academia, tech providers, and really innovation companies and best-in-class companies. And in that regard, I want to call out the lighthouses, which I think a lot of you are familiar with the concept, and it's the World Economic Forum has launched an advanced manufacturing and production platform in collaboration with McKinsey, and the lighthouses are basically companies and manufacturing locations and end-to-end value chains that are recognized as really very advanced in adoption of 4IR technologies. I'm proud to share that Johnson & Johnson has 4 lighthouses officially recognized by the World Economic Forum, and we're the only company with 4. And we have probably a couple of dozen unofficially recognized lighthouses, so as a network within Johnson & Johnson. And for us, we've been leaning into this and being part of this lighthouse community from day one in 2018, and really adopted and used the lighthouses as the beacons, right, the learning beacons for our organization, and leading the way to accelerate the adoption and scaling of 4IR solutions across our strategic value chains in our businesses. But also we use the lighthouses in our organization to really help shape and accelerate the development of those 5 innovation platforms I've been talking about. So they have been the backbone of our approach, of our supply chain innovation strategy, and they will continue to be. So we continue to leverage the lighthouses to experiment new technologies, experiment new or build new supply chain capabilities, and accelerate our journey going forward. And where the lighthouse network and community from a World Economic Forum perspective is, right, there are 54 officially recognized. The community is becoming broader and stronger, and we definitely also tap into that broader, let's say, community to benchmark, to leverage best practices and from those companies and sites and locations, but also leverage the capabilities. So it's a very strong collaborative ecosystem. So that I wanted to call out as an example how we leverage external innovation capability to help accelerate our journey, and how we help each other, honestly, to move faster together. With that, I like to move to the closing slide, which is the next slide. Thank you. And some key takeaways, right, to round up my presentation. First, I'd like to remind that supply chain innovation for us starts with the customer and the business needs and the opportunities. You really develop individual innovations and technology solutions, but you need to integrate them in those customer-centric innovation platforms to drive that standardization, rapid scaling in an effective and a sustainable way. It is very important to have a very structured, staged, disciplined innovation process, execution engine, around that, robust business governance and decision making to support that process. And last but not least, leverage and tap into the best of the best innovation brains and capabilities across the world, to leverage that global innovation ecosystem to help you accelerate your own journey and maximize the innovation speed and impact for your business. So our vision is really to reimagine supply chain innovation to become that future supply chain that is a competitive advantage for Johnson & Johnson to help us transform healthcare and change the trajectory of health for humanity in the future. So thank you very much for giving me the opportunity to share our journey, to share our supply chain innovation approach at Johnson & Johnson. Thank you very much.